every bundle of the needle. Okay, each and every stage of the needle. So you see the white tube inside the needle, and here also there is tube. Okay, this tube is exactly measurement to cross the acupuncture point or to cross the skin. When you are inserting the needle, no, so sometimes it becomes very painful when you are inserting the skin. Okay, we'll discuss about. But if you cross once the skin, then the needle is not that much painful. The needle is like sometimes the patient will not feel my needle is inside my body. I don't know. Okay, sometimes it's pains. Okay. So this tube is only for that to cross your skin. Just pull like this and just prick like this, then you will cross your skin. After crossing the skin, now you will go with very slowly and smooth stimulation. Like go very slowly. When you will touch the fascia, no? When you will touch the fascia, the patient will feel some kind of a sensation. Sometimes you will see the muscle is only contract like this. Just needle touch and muscle become like give you one spasm like this.
That's the right point.
That's the right point. Okay. So how you will go? First you will go on the superficial fascia. Okay. Patient is not feeling anything. There is not a spark or there is not sensation, pain, anything. Then try to go slowly deep. And when you will feel the sensation, that is exactly stop. The point, just stop the needle there.
Once more.
Okay. When you are inserting needle, okay, because very difficult to identify which layer of the fascia is weak or which layer of the fascia is becoming stiff. Mostly what I saw, a little bit like this, in stiff muscle, this fascia become the more stiff, the superficially. Okay, and in weak muscle, the deep fascia become the more stiff. Okay, so in this condition, what we'll do, when we insert the needle inside the muscle, we are inserting needle inside the muscle. When needle is going inside the muscle, and go slowly, stimulate the needle, go slowly, where you feel, where the person feels sensation, any kind of sensation, like pain, or maybe maximum time of the patients will give like the muscle spasm, like contraction like this. Okay, there the patient will feel that sometimes patient feels they are not able to explain what was that exactly. The patient will, yeah, there is something. Sometimes feel electric shock. Okay, if the patient is feeling the electric shock, then stop the needle there. Okay, and give like vibration like this. Whenever you give the vibration, and with each and every vibration, patient feeling the shock. That is your no. But once patient feel the shock, but now if you are giving like this, patient are not feeling anything. That was the right spot. Okay, so always remember how you are going to stimulate the needle, how you are going to insert the needle. That is the more important. To insert needle, that is not that much important. Okay, why acupuncture is the same? All your circulations, for example, artery, nerve, vein, they everything are circulating between the two muscles. Where they are circulating? Between the two muscles, not on the muscles. Where we are inserting needle? Understand? All the artery, nerve and vein, for example, vein is circulating superficially and between the two muscles. For example, this is my bicep femoris, here is second muscle. So, short hand and long hand. So, there is a gap here. So, my vein will be here between these two muscles on superficially. Artery will be deep. Okay? And nerve is surrounding more like on the side way. But where we are inserting the needle on the center of the muscles. Okay? For example, when you check each and every muscle's anatomy mostly, you see this nerve groove. Okay? The very minute minor nerve, sometimes app is also not giving that much of the correct. Okay, can you see this one? Like this, and I am showing you this one. See this one. Can you see this? The three artery nerve and vein. Okay. All the big nerve, artery, vein, everything they are traveling between the two muscles. Okay? Because muscle is contracting and relaxing. No. Sometimes, for example, you hold for a long time like this, and you block everything because you contract the muscles. Okay. So when you are doing like this, there is enough space between the two muscles to do the circulation thing. Okay. So that's why acupuncture is very safe. The dry needle, if you are inserting deep needle, there's nothing harm because you are inserting inside the muscle, not between the two muscles. And it's very easy. Where is muscle volume and where is gap? We'll learn now. Okay. Now we'll do the small practical. I'll show you if anyone having a knee pain, good opportunity to fix your knee. Later maybe I will not get time. You have a knee pain?
Used to when I was climbing.
Why you are not going to do your knee versus laterals? Come. Yeah, you do your